Hospice care is a crucial service providing not only medical care, but also physical, emotional, and spiritual support, allowing patients to spend time surrounded by loved ones in comfort. Yet too many families are still unaware of the benefits it offers. Joining us today to tell us more is Dr. Ross Albert, Hospice and Palliative Medical Director at Hartford HealthCare at Home Hospice. Thank you for your time this morning.
Thank you for having me.
Of course. Let's start here. For those who may not know, what types of services does a typical hospice program provide?
Thanks. Yeah, so hospice is focused on caring for people's comfort and their dignity towards their end of their life. And so it is an interdisciplinary team made up of physician, of nurses, social worker, spiritual care providers, all working as a team to ensure that somebody's care is focused on their comfort and on their dignity.
And let's talk more about how hospice care really addresses both the physical needs of the patient and the emotional need as well.
Yeah, hospice focuses on those two parts of someone really by looking at, the traditional ways we've been supporting people with medications, prescriptions, things like that for their symptoms, but also really engaging in the holistic approach with the social worker and spiritual care team, focusing on not just supporting the patient and their processing of the grief or emotion that they're going through, but also supporting their family, children in the family in ways that, again, will be really meaningful for them as well.
Absolutely. And obviously a big role in this, the hospice caregivers who are providing that comfort and care. Let's talk more about the job that they do every day.
Yeah, it's a really unique model of medicine. It started back in the 70s and 80s and still is focused on the idea that a lot of the care that we give to people, yes, we have the skilled team members that we have, but also, family members may be supporting somebody, or they may hire a hired caregiver to support them. And the hospice team will work to educate them and support them so they can provide that excellent care alongside of us, with us.
Absolutely. A lot of people may not know that the first hospice in the United States was actually started here in Connecticut, which is interesting. How can family members and friends support a loved one who is receiving hospice care?
It's a great question. I think there's a combination of sometimes there's the physical care that they might be providing, whether it's supporting somebody, just, sitting with them, being with them, adding that important connection, I think is so important for the person, the patient, who's going through this process. But also I think friends and family can support, as we said, those caregivers. They can give them a break. They can give them that extra time to while they're doing so much work and support, they can also give them that moment to take a break and have their ability to feel restored as well.
Absolutely. And Dr. Albert, before we go here quickly, what is your message to family members who are maybe afraid to talk about hospice care or go that route? Because a lot of people understand that hospice care is end-of-life care.
We know that Connecticut is 40th out of 50 on the wrong end of states in terms of how much we use hospice care. And we know that if people will talk about hospice more, if we'll talk about the idea that if it's the right fit for somebody, that we can really think about how we live on hospice care and not just about dying. We saw that with President Carter, who received hospice care for a year and still continued to do remarkable things even while on hospice care.
Great example there. Thank you so much for your time and the work that you do.
Thank you so much for having me.
Of course, and we will be right back.